And we are back. Welcome back, everybody. Orthopedic surgeon Dr. Mark Walgan is with me today, and he serves people around the Southwest Georgia area. Also, there's a website. It is simply your name. Is that correct? For people to go to?
Yeah, drwalgan.com.
Okay, and you have pictures, and you talk about a lot of the things that we've already discussed today where people can educate themselves and look exactly at what you're talking about with a lot of the pictures, which help.
Well, I actually use it as a tool when I'm sitting with a patient. I don't know what their baseline knowledge is about what a disc is or a facet joint or anything like that, so I kind of do a little mini education when I'm with them.
Yeah. And when you talk about surgery, you will sit down, and hopefully the patient has educated himself or herself enough before they see you. But because we all have a lot of questions when we're facing surgery, is it just a protocol list, if you will, that you'll sit down and go over with that person before you actually make that decision or not?
Well, I consider that everyone who comes in is sort of a blank slate. I sort of need to start with the baseline anatomy and talk about the different disorders they have or whatever's their condition and go from there, go over all the risks and alternatives.
Yeah. Also, do you see a lot of older women, because when you talk about the herniated disc or the back wearing out some, you said during the break it's kind of like a cracked egg, if you will, very fragile. So do a lot of those women, or are they seeing signs already of osteoporosis but still maybe facing surgery as well?
Well, a lot of older women that I see really have like 3 strikes against them. I mean, if they're postmenopausal, advanced age, it's more common in Caucasians to get osteoporosis, which is thinning of the bones. And they don't necessarily have to have a trauma to get a compression fracture or a vertebral insufficiency fracture because the bone got so weak. They could cough and get it. And if someone in maybe over 65 gets back pain or thoracic pain where the ribs are, you have to rule out a compression fracture until prove that it's not.
And when they're facing surgery and they've decided this is the best route for me as the patient to have the surgery, and maybe they're still working a job, have family responsibilities after post-op because they worry about how long they may be out of work and changing their lifestyle totally because you have to recuperate. And it depends on case by case, but what is the usual time?
Well, everyone's different. I mean, if you're having a fusion where you're trying to get 2 bones grow together, which is the treatment for a bad disc, that will take several months. But if it's something where you're decompressing nerves, like with a herniated disc, or where there's not enough room for the nerves, like with spinal stenosis, it might be in the matter of weeks to recover. Okay.
Your website, once again, is simply www.drwalgan.com.
drwolgin.com.
A lot of information, a lot of photos there that you can take a look at if you're facing any type of back surgery, whether it's disc surgery, because always ask a lot of questions when you sit down and talk with your physician because it will help you out as far as recuperating and also just more than easing the pain in the back, just putting the mind at ease as well. It's good to have you on today. Thanks for being here.
Thank you very much.
Good information. We appreciate it. Carla, back to you.
All right.